If this is a practice session that is prior to October 1st, 2015, and you want to play with ICD-10 to see how it works, you want to go to Tools, Other, and then ICD-10 Test Mode. And it's telling you that you're about to enter ICD-10 test mode for test patients. And I'll say, go ahead. Yes, I'm sure. And at this point, it's warning me to only work on test patients when I'm in test mode. We don't want to be in test mode with live patients. And then we're all done with test mode. We just want to exit out of the system and come back in. And that'll bring us to our normal working mode, which would normally be ICD-9. That is prior to October 1st. After October 1st, 2015, you'll automatically be in ICD-10 mode and you won't need to go into test mode. So now let's take a couple samples and look at a couple of different ways to work with ICD-10. First of all, I've selected a patient here, and I'm going to go ahead and select diabetes on the patient's problem list. So as I click on that, 10guide automatically opens up, and you can see that this patient's problem list was ICD-9 coded, and that's why 10guide opens up. It converts the ICD-9 code of 25000 to an E11.9. But then it shows me the child records off of that code so that I can go ahead and select different options. I'm going to go ahead and select with kidney complications. And as I do that, it changes it to E11.2. And then it opens up the next branch set of options. And I'll go ahead and say diabetic chronic kidney disease. And there I have my final code, E11.22. Now I can, of course, just change the answers here. And as I do that, I go to with complications, and then it changes the options that are presented at the next level. And I'll go ahead and say skin complications, and we'll say diabetic dermatitis. So you can see at this point, now I've got my code. It's building as I go along, E11.620. The E11 is the base code for diabetes. The 6 represents the with complications in the first box. The 2 is the corresponding code for skin complications, and the 0 is for diabetic dermatitis. If I select foot ulcer, you can see that it changes the third digit. And then if I go back to the second box here, you can see that it changes the options that are at the third level. So once we're done and we selected the code that we want, we can go ahead and click on select. Now, if at any point I answered questions that I don't want to answer, I can right click on that box and it will unanswer that question. And then we can just go from there. So if you over select, you can unselect it. Now at this point, I want to explain the fact that at some point you do need to select a completed code. Now, a completed code is a code that has no further options. At this point, this is not a completed code because you can see that I've got options here that I didn't choose. And so this would not be valid for billing. So at some point, you're going to want to select that completed code. But I'm going to go ahead and actually I'll go back to with kidney complications and I'll make my selection there. Now in this case, there wasn't a third box that appeared after diabetic chronic kidney disease because that's as far as it goes. You can't tell by looking at the code E11.22 whether it's complete or not because you don't know whether or not there is a third or fourth digit on this code until you actually select it. So I'll go ahead and leave it there and just click on select. Now, because this item was on the patient's problem list, I'm going to go ahead and double click on the patient's problem list to show you that it updated the code here based on what I selected. But then also notice this checkbox here that a complete ICD-10 code has been selected. That's how the system knows that you have completed this code, that you have selected an ICD-10 code. When you initially start off and your problem lists are ICD-9 coded, the first time you select that item to deal with it in a visit, the system sees essentially this checkbox is not checked. And so 10guide appears and it presents the options for you to complete it. Now, because I already did that, the system checked the box for me. So that means the next time this patient visits and I click that select button, I'm not going to get 10guide. It's not going to open up for me because I've already done it. All right, so let's go on to a couple of other things. Let me just, first of all, go back to the problem list. And I want you to notice that you have a lookup button there, a magnifying glass. If I click on that magnifying glass, that reopens 10guide, and it lets me make a change to it if I need to do that. All right, so that's another way to do that. Now, again, there's no need to do that in advance. Even though your problem lists are ICD-9 coded to start off, there's no need to go in and one by one update them to ICD-10. The easiest way to do it is you do it on the fly. So you click the select button just like you always have, and when that happens, the system sees that the code has not been updated to a complete ICD-10 code, and 10guide presents the options to you. All right, so now I've got diabetes in there, and let me go ahead and select a problem from the diagnosis encounter form. So open up my diagnosis encounter form, and I'll select a URI. Now notice that this encounter form is ICD-9 coded. That's how yours start, of course. At some point you will want to switch them over to ICD-10 codes, but there's no urgency to do that, because when I select an ICD-9 code off the encounter, the system automatically converts it over to its appropriate ICD-10 code. 10guide opens up and it says, well, in this case you've got two options, and I'm going to just leave it there at upper respiratory infection, and I'll click select, and that's all we have to do for that. Notice on this encounter, you can mix codes. You can have most of these are ICD-9 codes. But if you look down here, you'll see that that's an ICD-10 code. You can tell because it begins with a letter. All ICD-10 codes, the base code, the first 3 digits, begin with a letter. So I'm going to go ahead and select a sprain of knee. And as I do that, 10guide opens up, and I've got a bunch of options. And I'll go ahead and I'll pick a sprain of collateral ligament, and then we'll do a medial ligament, and then right knee. Now this is the most complicated code that there is, because we've got essentially a base code of 3 digits, and then after the decimal there's 4 other places after that. Again, the S83 is the base code. The 4 corresponds to the first box. And the 1, the medial collateral ligament, is actually internally coded as a 1. Right knee is 1, and then initial visit is the A. And you can see that as I change the options here, it changes the options on the subsequent levels. But I'll go ahead and just return it to a sprain, and I'll say it's right knee. Now, a common question is, well, what if I don't know that information? A lot of times you don't have all that information, and you wouldn't unless a film was taken. In that case, you have an unspecified. The general rule is that insurance will accept an unspecified code when it is an option, when it is not expected that you would know that information. In other words, if you're expected to know the information, then you need to complete it. So I could say unspecified here if I'm a primary care specialist, and I don't know the answer to that. But I wouldn't get away with saying that it's unspecified here. If this is a valid code, but undoubtedly your insurance would deny this, because they would certainly expect you to know whether it was the right or the left knee. I'll go ahead and I'll click select there. Now, another thing I want to point out here is that on the encounter form, we have ICD-9 codes. We have, this case is a base code for an ICD-10, but here's a fracture code. And notice that the fracture code that's listed here is a little bit more complete. It's got another digit. So the program will allow you to have ICD-10 codes at various levels of completion on your encounter form. The reason why that's important is because ICD-10 has much more details, more specificity, and that means more codes. And so if you were to take every one of your ICD-9 codes that are presently on your encounter form and convert them over to all of the options of ICD-10, you would end up with many, many pages, and it would just become unmanageable. So you can, in this case, we just had a base code. In this case, we've got a base code plus one. I'll go ahead and click that. And all it does is it simply provides a starting point. So I got fracture of forearm, and I can say right, and at that point, I can leave it alone. Notice the X in the code is simply a placeholder that's required. You don't have to do anything. You just simply answer the questions, and that fills it in for you. Now at this point, I also want to call your attention to the fact that there's a rename button here. So if this is a code that I'm going to use regularly, I can rename it and just click on the rename button, and then that will save it to my active table with whatever description I want. That can be helpful because a lot of times the descriptions that come over from the complete ICD-10 code set are very verbose, and you may have more abbreviated descriptions that you want to use. And then finally, one other thing that you can do to select a code is, of course, you can use your select buttons on your encounter form, and then that pulls up the lookup window. So at this point, I'll just put in hypertension, HTN. By default, the system lookup is going to look through your active table. All right, that means you don't have to jump through any hoops or worry about any changes in terms of your ability to find codes. Even though the descriptions are much longer and maybe different than what you're used to, all of your active table entries, that is your previously used ICD-9 codes, and they're in your table, but they're also coded to ICD-10, automatically coded to ICD-10. So you can look up any ICD-9 code, whether you use an abbreviated description like that or you actually type in the 401.9, and the system will find it. It'll convert it over to its appropriate ICD-10 code, and then 10guide opens up. And in this case, hypertension is a really simple code. I-10 is it. There's nothing else available after that. And so this point, I would just click select. So the point is that on your encounter form, any place where you're doing a lookup, whether it's on the problem list or the encounter form, all of your lookups are really going to be simple for you. No change you have to adjust to, because all the descriptions that you're used to and the ICD-9 codes that you may be used to, you can use them, and they simply provide a starting point for you to go ahead and select a complete ICD-10 code. All right, so let's do that. Let's do that one more time. In this case, I'm going to do abdominal pain, and I could have also typed in 789.06 if I knew that code. In this case, I put in ABD, it pulls up my descriptions, and that's because it's looking through my active table, which are the descriptions that I'm used to. If I wanted to start with just ICD-10 codes, I can uncheck that, and it would look through the descriptions that are from the ICD-10 code set, which generally aren't going to be as helpful as the ones you already are used to. I'll go ahead and select this one, and you can see that it converted over my ICD-9 to an ICD-10, and it answered the questions based on that conversion. But at this point, I have the option to make some changes to that. And as I'm clicking on that, you can see that there's no other options that appear. In other words, there's not a third box or a fourth box that appear with other options. So I know that this is a complete code. So I'll go ahead and select that, and then we'll be done with that. Okay, so now just a couple more things to cover. First of all, when you select an ICD-10 code, you want to eventually have a complete code, because that's the only kind of code you're going to be able to bill. And you really want to do that on a clinical level. You don't want the biller to have to answer questions that he or she may not know. You don't want to have increased communication back and forth trying to get clarity on that. On the clinical side, you want to select a complete code. You have two options two opportunities to do that. First of all, you can do it when you select a code. We saw that when we selected an item on the problem list, and we saw that when we selected items off of the diagnosis encounter form. So at that point, you have the option to enter a complete code, answer the questions in 10guide to get a complete code. Sometimes you won't have the answer to those questions until later on in the examination. So you can always go back and take a problem that's in red and just simply click on the recode button. And when you do that, that opens up 10guide and it lets you change your answer if you want to do that. Okay. And then finally, if you don't select a complete code, when you close a visit, the system would automatically pull that up. It would recognize that of all the problems that you've selected, here's one or two that you chose not to complete, and it will give you opportunity at that point to complete the code. Again, that's really important because if you don't complete it on the clinical side, then the claim cannot be billed because the code has not been completed.